the Shore Health System joined the University of Maryland in 2006. And at that time, the new regional medical center was on the radar. But what also happened in 2008 was Chester River Health System joined the University of Maryland. So for a couple of years, we were competitors within the same geographic 5-county region. But over time, in 2013, we created Shore Regional Health. And that was really the onus of creating one integrated healthcare delivery system on the shore that is complemented as a member organization within the University of Maryland medical system. So as we're working on the shore, we've got 5 counties of care, and we really started looking at each county and saying what solution is best for the communities that we serve in each county, but predicated on a regional delivery system with a regional medical center in place. So back in 2010, 2011, we built the emergency center in Queen Anne's County. That emergency center today serves almost 20,000 people a year just in the ER. And we complemented that building with the 3-story medical office building. Primary care, specialists, diagnostic testing, but all designed really to provide comprehensive local care for Queen Anne's County. As I look around the other parts of the region, then we focused on Caroline County. And Caroline County really had very limited service, and where we were was not conducive to the UMMS and Shore Regional Health System brand. So we created a 2-story medical office building right off of Route 404. And today in Denton, that serves as the hub for healthcare services in all of Caroline County. We complemented that with an urgent care center there. And really it's thriving as the community campus for healthcare services, primary care, diagnostics, specialists, great rehab facilities, and urgent care to complement the county's needs. But we weren't finished there, Dave. As we looked at Kent County and Chestertown, we recognized that the community needed acute care health services in that county, given the geography and the distance between Easton and Chestertown. So we really work closely with our state partners at the Maryland Healthcare Commission and the Health Services Cost Review Commission to really be innovative and creative as rural Marylanders need to do. And we really came up with a solution that said, let's keep the acute care aspect of the hospital in Chestertown, but let's focus on those key strengths of what a critical access hospital system is all about. It's the first Maryland rural hospital for the entire state that really focuses on the unique needs of a small rural county. But we weren't finished there. Then we went down to Dorchester County and said, you know what, we've got an aging hospital in Dorchester right on the Chop Tank. How do we create a win for the community, a win for the healthcare system, and most importantly, a win for the patients who need our services? And that's when we developed the freestanding medical facility. We opened that facility in October of 2021. And really that serves now as the hub for healthcare services in the region. We sold the property to the community, and now it's getting ready to be developed for just a waterfront vision that the community has had for over 2 decades. So all of these single county decisions have been predicated though on building the new hospital in Easton and in Talbot County. So we're at that stage now where the last decade's worth of work is now ready. And we are ready to proceed with that vision.
If I could jump in for 1 second, I would tell you what Ken describes is a dramatic amount of effort in helping also the state, the regulators in the state, understand the evolution of care delivery and partner with us. Because when he talks about the emergency room in the freestanding emergency room on Kent Island, that was a first in the state kind of innovation. When you think of a critical access hospital with aging and wellness in Chestertown, again, first in state innovation. And when you think of what was done in Dorchester with a freestanding medical facility, our state didn't have those models before Shore Health System and the medical system brought them to the state to say, look, we have to think about rural healthcare with an evolved lens of how we think about creating access points and care deliveries in rural healthcare. This is a national conversation, right? The evolution and sustainability of rural healthcare access. And I'm going to argue that I think what has been created on the mid-shore across 5 counties with the incredible geographic diversity and community diversities that these counties represent really is a model for the state. And indeed, you know, as we succeed, for the nation to understand what can work.
Dave, you know, when we look at what this facility will offer the mid-shore, it is going to be the regional hub of inpatient care and services for the 5-county region. It will take all of the regional services that we offer today and put them in a state-of-the-art facility that has private rooms for every patient that we see, that is state-of-the-art in the form of technology and equipment, but really, and help us recruit and retain providers and team members on the mid-shore. What we envision is about 325,000 square feet of hospital-based space. And that will be complemented with about 60,000 square feet of medical office building space that'll be adjacent to the campus. So we're talking about the site that is actually right on Route 50. As you come up Route 50, head east towards Easton, you'll pass the community center on your right. And we own and occupy the land that is adjacent to the community center right off of Route 50.
So presumably at the end of 2023, we'll have a realistic price tag.
And that's something that we're still working on. As you can imagine, Dave, we still have about 2.5 months worth of work that we need to continue to do to ascertain the final size, the final cost of the project. But we'll get to those numbers and submit them as part of the application in January.
Yeah.
So part of the important understanding of the process is that the CON process with the state is an iterative process, meaning we submit an application, they come back with questions, and they challenge some of our assumptions. And so it is a process that continues to evolve. And
while we're focused on the CON application at this point and getting that completed to meet the timeframe that the state has, once that application process is submitted, we'll then start to work with our community partners and community elected officials to gather around the table and talk about what the art of the possible is with our property in Easton. You know,